Hi guys, this is Lisa Strawn from Dr. Stewart and Thaxton's office, and we are here because October is Breast Cancer Awareness Month. So we decided to take this opportunity and ask some of our patients who have gone through the journey to share their journey with you all. So our first patient that we have selected is Robin.
Hello.
And she is here to talk about her journey with breast cancer.
Hey.
Hi there, how are you?
I'm doing great.
Okay,
Great.
so tell me when it all started.
The nightmare began in June of 16.
June of 16,
I had
okay.
a little lump come up, and working in the medical field, we tend to ignore things or not take care of ourselves
Right.
as much as we
Right.
that we should, even though we tell others. So I went straight away to the doctor, and through many tests and things, in the next couple of days found out I did have triple negative breast cancer. The thing I want to stress so much to women is that triple negative is a breast cancer that's only about 10% of breast cancers.
Wow.
That it does usually come with a BRCA gene. There's a BRCA1 gene mutation, BRCA2, and your doctor, family doctor, gynecologist can schedule that appointment to have that testing done. It's just lab work,
Right.
but that's usually where it comes from. I, however, did not have the gene, which is a blessing.
Right.
Because
That
then
is-
you have to go deeper into the female reproductive part. So then we said, well, where did it come from? Well, we really didn't need to know where. We just wanted to know, how are we going to get this out
How are you
here?
going to deal with it?
Right. So it seemed like for the first 6 months it was just a whirlwind of shock, and just about anything they told me to do, I did. I didn't question a thing because I was just so in shock.
In shock.
Exactly.
Right.
For months. I did the chemo before because they said the tumor was fairly large. Did that for about 4 treatments, and my white count just couldn't handle that. So I got with Dr. Witzberger, who is a surgeon,
Right.
wonderful surgeon. And he said, do you want to do a lumpectomy? And I said, absolutely not. I want it completely gone.
Right.
Because we knew it was in the lymph nodes. And they said, do you want a plastic surgeon in while we do the mastectomy and take over? I said, absolutely not, because all I'm worried about right now is staying alive and kicking this thing.
Right.
Went through the surgeries, got through all the chemo, radiation, came to Dr. Stewart and Thaxton's Broad Day right after my mastectomy.
Okay. And how did you hear about it?
Actually, my Dr. Thaxton did carpal tunnel surgery on my husband.
Oh, wow. Okay.
Yeah. So I saw it on Facebook that he was having it, and I said, heck yes, I'm going. You know. So I went, and Dr. Thaxton answered so many questions that day that had just worn me down.
Right.
Thinking about, worrying about. And so I thought, when my time comes, that's the man for me. So I'm also very damaged now after all of the surgeries and things. So I came in again the next year for Broad Day.
Right.
And listened to the same basically story and how things had evolved and changed. Knowing I couldn't have expanders under radiated tissue, it was just very scary. I had heard about tram flaps, which are something that's not commonly done. It's pretty risky, and I'm not a surgeon, but I know they use belly fat and all that, and I just couldn't imagine going through that. So I came in for my consultation with Dr. Thaxton, and he basically sat down with me, and he is so caring and kind.
Yeah,
and
he is.
he really listens to you. You know, all your fears, and I mean, he truly listens to every word you say. And he said, I think we're going to have to do a latissimus flap. Well, everybody says, what's that? Well, they actually take your latissimus muscle, which is your back, and rotate it under your arm to your front and actually create a breast. Now, I know that sounds incredible. And you are going to think, oh, wow. And it is a lot of surgery to get through. It is. But the results, I had chills.
Aw, isn't that nice?
Gave me my life back. He gave me my life back.
Wow. So when this process started, what was the time when you first came in here? What was the time span where he did his surgery to where you are now?
We started this in February.
Okay.
And we were going to do a tram flap this side. That was the radiated breast. And I went ahead and had a prophylactic mastectomy on this side so we could sort of match them up. Instead of trying to create a breast and get it the size of a 50-year-old breast, lifting and tucking and all that, I just said, let me go to the surgeon and have it removed. Let's just start from the ground up.
Right.
So we went in for the surgery, 7-hour surgery.
Wow.
Came out and Dr. Thaxton says, well, I have good news and bad news. And I'm thinking, there is no news that can be bad from this man. And I had an underlying infection from the prior removal of the breast on the left side. So had I not went ahead with the latissimus flap and he go in there, that underlying infection could have went crazy at any time, and I could not be here right now.
Right.
So I wasn't down and discouraged.
Good.
I said, thank God you found it. Plus, hindsight of the post-op stuff, it was a lot easier to do them at different times.
Right.
And I'm not going to say it was easy.
Right.
And I'm not going to say that I wasn't nervous. I'm not going to say that I wasn't in pain, because if someone tells you they've had surgery and they're not in pain, they're probably lying.
Right.
Because even though your breasts are numb, and a lot of women going through breast cancer, we experience so much, but the one blessing that I had was my whole chest was numb because all the nerves were taken to.
Right.
So, went back 3 months later, had the other one done. Expanders were placed in. If you want to hear more about expanders and that type of thing, you need to call Stuart Thaxton and they'll explain that with you. It basically stretches the tissue, getting you ready for an implant.
Right. That's right.
And so after the expanders had been long enough, we went back. I'm 3 weeks post-op my exchange surgery. Expanders out, implants in, no pain, no problems, blessed, chills again. This place is amazing.
Oh, well, you're sweet. I appreciate you sharing your story with
it's
us.
an education. It's a process, and I wish more women would talk to other women
about it.
But I have to give kudos to this staff here because, on a Thursday, I came in and consult and I said, okay, let's do it. And there's a girl here named Penny who I have known for years. And she said, Doc, if we don't get her on the schedule, quick, she's going to cancel on us again. And so I scheduled on Thursday, had it done on Monday, and I would do it all the exact same way. But the main point that I want to make more than anything in the world is please stay positive. However your religion is, whatever your belief system is, I mean, my deep dedication and devotion to my Lord and Savior and all my prayer warriors, I could feel every hug, every prayer.
That's so
everyone
nice.
here, you come in, they hug you, and you feel like family here. You really do.
Oh, well, thank you. You're
anybody worried about cost? I worried about that. A lot of women don't have Reconstruction because they don't know that insurance have to. It is mandatory.
Yes, ladies, it has to be. It's paid for.
It has to be fixed. It's not like it used to be, and I'm just so grateful that I came to those 2 bra days.
Well, I hope you're going to be coming to our
I'm absolutely going to be at this bra day, and I'm going to be a model, and I'm going to show you all how wonderful you can look after this horrible disease is gone and you start living your life again.
Thank you so much. That's right, folks. We are doing our Bra Day 2018 on October 17th from 3 to 6. So anybody that wants to come, it's free. It's a free educational event. We would love to see you. You'll get to see Robin, meet her, talk to her, ask her her advice, things like that, okay?
I'll be more than glad to be here, and please do it, please. Even I know it's just a few hours, but please come and listen. I don't gain a thing from this, but you will gain everything. Just come and listen.
Thank you so much.
You're welcome.
I appreciate
I will be
it.
so happy to show my results. I'm tickled to death.
Thanks.
Thank you.